She's an audacious dreamer.
The first word that comes to mind is visionary.
She's an idea generator and higher level leader.
Dr. Miller's most impactful legacy will likely be one where thousands of women in BC and worldwide will never know that they were ever at risk of getting ovarian cancer.
We need to have people like her to try and conquer this disease, which I'm sure one day we will.
3 surgeries and 2 bouts of chemotherapy, but right now, I mean, things are looking really good. I don't treat patients, I treat people. I think that's the big thing. I grew up in a community that didn't have a doctor. I grew up in Greenwood, British Columbia. It's the smallest city in Canada. And I didn't decide to be a doctor until my 4th year of university. I really enjoyed the gynecology, and I specifically enjoyed looking after cancer patients. What appealed to me was that, really oncology was one of the first areas to embrace evidence-based medicine, where we were collecting outcomes on patients and trying to do better. In gyne-oncology, the biggest challenge is ovarian cancer. The problem is it's a disease that's diagnosed very late, and the mortality rate for the disease is huge.
These are the cancers that are affecting our mothers, our sisters, our daughters.
Most patients who are diagnosed with the most common form of ovarian cancer die of disease.
It's not easy to look after women with ovarian cancer. Watching women suffer and many of them die is beyond frustrating. But it's also really motivating.
We haven't actually found the clue as to how to cure this cancer. And I think you kind of need that little epiphany moment where you say, it's not good enough to just keep doing the same thing over and over again and never really making any progress. So I think that was the birth of OVCARE, is when we just decided we can do better than this.
I got to know Dianne at the inception of OVCARE. She called a meeting of all those who were interested in ovarian cancer and basically declared that she was sick of seeing women die of this disease and felt that if we worked better together, we could make a difference.
She unites people. She brings people together for a common goal of trying to improve outcomes for women with cancer in this province.
The first thing that really came out of OVCARE was an understanding that we weren't dealing with one disease, that we were really dealing with 5 separate diseases. So immediately you go from following 1 track to following 5 tracks. The answer in terms of prevention and therapy was going to be different for each of those subtypes.
A stunning innovation which came from Dianne is the realization that many ovarian cancers don't actually come from the ovary. They present on the ovary, but they come from the fallopian tube.
If there's one thing better than curing cancer, it's never getting it in the first place. We launched the world's first ovarian cancer prevention program of opportunistic salpingectomy, basically changing the way we do a hysterectomy, taking out the tubes with the uterus, leaving the ovaries, taking out the tubes.
It represents a really incredible opportunity to prevent a cancer for which we don't have a cure.
We believe that we could prevent up to 40% of ovarian cancers with this approach.
The opportunistic salpingectomy work that has been done is essentially the standard of care in BC, but also across Canada, and it's something that's been accepted worldwide.
The opportunistic salpingectomy program was her idea, and there's very few people who can say, I had this idea, and it's changed the world.
The second part of our prevention program is universal BRCA testing of all women with high-grade serous cancers. If we can identify that, we can then test their children, sisters, cousins, etc., and we can identify women who are at extremely high risk of this cancer and prevent it in them.
She's helped create an environment where we've received a lot of support from the VGH and UBC Hospital Foundation. And that support complements the grants we received. It has allowed us to go from an interesting idea to becoming a global leader in clinically relevant ovarian cancer research.
I think probably my 2 major personality traits are optimism and stubbornness. I'm always willing to take the curve in the road when the straight route doesn't go and look towards trying to get a better outcome. I truly do believe that we can decrease the incidence and mortality and suffering from this disease by half. You can make a difference. It is possible.
She has taken this cancer from a point when it was a hopeless situation to now women leave our clinics with hope.
If we can take anything that she's taught us and bring it forward to the next generation of women, then I will be grateful.
Congratulations, Dianne. This is a very well-deserved honor.
You have impacted the lives of many women in our population, and we are all grateful to you for that.
Congratulations, Dr. Miller, on your Lifetime Achievement Award. There isn't anyone more deserving of this award than you.
I'm so grateful to have you in my life.
On behalf of the whole OVCARE team, from all those you've mentored, and in particular the countless women whose lives are going to be saved through your opportunistic salpingectomy program, I'd like to congratulate you on being awarded the Lifetime Achievement in Health Innovation Award.